need to talk.
Good afternoon, everyone. Thank you for being here this afternoon. We're going to go over your benefits for the new plan year starting January the 1st, 2025. Glad to have y'all here. We have some members with our new carriers, and we'll be talking to you about that in just a little bit. Who's here, and you can take some time. Mr. Harris, Reed. We'll be doing the presentation. He's our broker with Enrollment. We have Deborah in the back. She's our broker as well. They help us a lot in bringing these plans to you and giving you the information and the best benefits that we can get for our employees. So with that, I'm going to turn it over to Harris. We're going to get started, and we'll have some introductions with our carriers here. And if you have any questions, please do not hesitate to ask.
Thank you, everyone. Can you hear me? Okay. So it is open enrollment time again this year for 2025. So what we're doing, same thing we do every year, where this is the time of year that you go into the benefits in hand online system that we use for our enrollment, and you're making your elections for your plans for 2025. I'll give you the 50,000 foot 40-second speech real quick. In general, as far as your rates, the plan designs that are being offered, etc., there's not a lot changing. Your rates are going to be pretty much the same, especially on the medical plans. Your plan designs for your medical plans are going to be the same as they are right now. We're just changing carriers. And then dental, you're going to have the same option between dental HMO and dental PPO. We're just changing carriers on that. But it's kind of like the more things change, the more things stay the same. So everything as far as your costs should be right in line with what you're paying currently.
I got you. I got you.
You got it?
Oh, wait, we got it back.
So open enrollment, the system actually opened up on Monday. So you can go in your system right now, make your elections. Open enrollment will stay open through, well, Melanie told everybody the 17th, that's just because I told her to tell y'all the day before it's actually going to close. It will actually be open through the 18th. So if you make your elections and then you go, oh, Brett, I want to change something, you can go back in there and make a change online and go through for one more effective date. If you don't remember, you go to www.benefitsinhand.com. There's some pages in your enrollment guides about how to get into the system, and then what you use for your, hopefully you have your login still or can remember it, but there's also a way to reset your password on there. And if you're still having trouble with that, Melanie and her team can reset your password inside the system. And then you can reset it if you need that help. So just a reminder, the elections you're making right now will be effective on January 1st. So keep using everything you have already through the end of the year. And then January 1st is when you start using the new insurance.
So I just want to key in on that. On your benefits in hand, everyone will need to go in and make your selections. This is not passive. You have to make a selection. Either you don't want it, I don't like it, don't give it to me, make a selection. The big thing I want you to remember in there too is check your mailing address, check your phone number, your email address, your beneficiaries. Did something change? Are you mad at somebody? They're not your friend anymore. Did you get divorced? Did you get married? You know, those kind of things. Please, it's so important that you do that and check that, okay? Talking about mailing addresses. If you're in a high deductible plan with a health savings account, okay, you cannot have a P.O. box listed as your street address. Federal government, IRS, Homeland Security, all these people that do the banking will not send out and give you a bank account PO box. So to do that in the benefits enhanced system, you will put a street address in there. Then you will check mailing, and that's where you would put your PO box. Okay? So first you're going to put your street, and then you're going to check a mailing to put the PO box. So very important for you to make sure that all your dependents are listed, the beneficiary is really big on it. Okay?
New wives do not get happy when the life insurance company says they have to pay your life insurance policy to your ex-wife who's listed as your beneficiary. Trust me, because I've seen it.
Yeah, I have too. Or girlfriends that aren't your girlfriend no more, so your mama can't get money.
Okay, like I said a minute ago, pretty much the plan designs themselves are not changing. So you're still going to have the kind of skinny down PPO or EPO where you're in network only. We use Kelsey Care right now for that. The good thing about that is changing is if you enroll, and that's the lowest cost option, if you enroll in that, you're still going to have Kelsey to be able to use if you want to use Kelsey, but it's actually going to expand the network beyond where you aren't restricted to only using Kelsey. So it adds in like St. Luke's and Memorial Hermann, a couple of the other healthcare systems. So the price is still going to be the same. The benefits, the co-pays and all that are going to be exactly the same as it is on the Kelsey Care plan, but you're going to have a bigger network available to you, and you don't have to just use Kelsey people. So that's a cool thing. Buy a PPO type plan that has office visit co-pays. Again, the rates are going to stay exactly the same. The plan design is exactly the same. Cigna's big network, so it's comparable to the Aetna network we have now. The high deductible health plan, the only thing that's changing on that is the actual deductible is going from $3,200 up to $3,300. And that is not because we wanted to make y'all pay more money, that is because the IRS raised the minimum allowed deductible amount for high deductible health plans. So we had to do that change in order to comply with IRS regulations. So I mentioned we're changing carriers on pretty much everything. So the medical is going from Aetna to Cigna. We were with Cigna for many years prior to moving to Aetna a couple of years ago. So hopefully you're familiar with Cigna. The vision, the dental insurance, the life insurance, the disability insurance is all going to be moving over to Lincoln Financial. We'll get into the details about all that in a minute. Aflac is going away as far as a city-sponsored benefit as of 1/1/2025. However, if you like your Aflac products and you want to keep your Aflac products, you can, and Melanie has sent out information to everybody that has Aflac products already, you can go directly to the Aflac rep and they will direct bill you instead of billing it through payroll through the city. So that's kind of the big thing that's changing with that. If you want to keep your Aflac plans you have, you can do so, but it will no longer be run through payroll on a pre-tax basis. Aflac will be direct billing you for that. We are replacing the Aflac products with Colonial. So pretty much for the most part, same, although a lot of the Colonial plans allow you to get higher maximums than what was offered through Aflac. And because we're doing it as a group plan instead of the Aflac products we have now, we're technically individual products. So we're doing it as a group plan through Colonial. So the rates, in a lot of cases, are going to be cheaper than what you're paying for the Aflac plans right now. Jody was saying a minute ago, and I thought it was a good point, the one thing that she was talking to somebody about that you might want to consider is if you've had an Aflac cancer policy for a really long time. Those older cancer policies don't have a maximum cap on it. So if you do have the Aflac cancer policy and you've had it for a pretty long time, you might want to go double check your policy to see if it has a cap on it. And if it doesn't, you probably want to keep that. And if you want to keep the cancer policy and pay that direct bill with Aflac and keep that policy in place. Because all the newer cancer policies do have a cap on them of a maximum benefit. So that's the one thing I would tell you to look at if you're considering changing. Yes.
Can I mention one more thing?
Yeah.
All of the colonial plans are guarantee issue with pre-X waived. So if you've had health issues in the past and maybe weren't able to get an Aflac plan, you can get a colonial plan because it's guarantee issue. So just thought I'd throw that out there. Thank you. Sorry.
The city's short-term salary continuance plan, basically their short-term disability is staying same parameters on that. The light, the health advocacy program that we have is staying in force. And then employee assistance program through UTVAP is staying the way it always has been. So again, these instructions I think are in your benefit guide that you all got, but you've got benefits in hand to enroll. Is everybody here a current employee or anybody really new, like within the last month? Okay. Good. So eligibility, just want to reiterate this. So your eligible dependents are your legal spouse, your children, which can include your legal spouse's children, court-ordered dependents. So if you've got a niece or a nephew and the court has ordered that you're, legally in charge of them, that is acceptable. Your adopted children, obviously your own newborn, and your kids can be covered up until age 26. So when they turn 26, at the end of the month they turn age 26, they're no longer allowed to be on your plan. So they are allowed to stay on until age 26. So again, like I said, this is the high deductible health plan for 2025. The only thing that's changing between what we have now and what's going to happen in 2025 is, again, that deductible, which is the very top line, goes from $3,200 to $3,300. I'm trying to figure you want to follow along in your guide. It's on page 11. So one other thing that's changing, and this is kind of a big one. We've always traditionally had our HSA banking tied to whatever insurance carrier that we were with on our medical plan. And every time we switch medical carriers, we end up having to switch everybody's HSA accounts, which is a big pain for everybody. So we have finally broken that out on its own, to its own deal, to where that's not going to ever happen again. We were going to have to do it no matter what, because we're changing medical carriers. So we figured, hey, let's break banking out for the HSA accounts into a separate deal, so it's no longer going to be tied to the medical carriers. So going forward, we're going to have to go through this one process one more time. And going forward, unless something drastic happens, you'll never have to worry about moving your HSA account. Okay? So the company we're moving the banking to is called Lively. And you'll get some information about how to transfer those accounts. Basically, after your last payroll in December, which I think is on the 20th. So somewhere after that, before the end of the year, you'll get instructions how to go in, and you go into their website and you can initiate the transfer from your old account to the new account online. You'll need your old account information. So if you've got like a statement or if you have an app for it, you can go into that and have your account information with you, so you can put all that information into the live.
Can I see a hand of who has an HSA right now? Great, okay, so we got the majority here, so let's talk about it a little bit. I didn't want to talk about it too much if nobody really does it for confusion, right? So your health savings account, we're going to library, okay? There is a fee of $25 to move your money from PayFlex and Sparity to library. The city's going to cover that, okay? We're going to cover that fee because we think it's important to pull this out, get it separate, so we don't have to go through this again, okay? But there will be some administrative that you have to do on your side. However, Lively, they couldn't be here today, but in all my implementation calls and things, they're ready to help. They're going to have people to help. You're going to be able to go onto your Lively website, see everything about the middle of December or so. But you're going to get an email from them saying, hey, welcome. Let's set this up. Let's get this going. And then after that last paycheck, you don't want to do it before December the 20th because you want all that money to get into your current. Then you're going to tell Lively, hey, I want to transfer my money. You're going to do it all on this thing. You're going to work with Lively. They're going to help you when you need it. Okay? Get it to spirit. What I'm saying though is that there's going to be a couple of weeks period where that money on your current is not in your new account. So if you're having any procedures or you're having any doctor visits or what have you, if you need to use that money that's in that current account, if you can wait and reschedule or do it at the end of January so you're not hooked up into that. Now the city, okay, so there's a big caveat too here. The city's increasing your HSA funds this year. For individuals, you will get $1,000. If you have a family member, you and your plus one, a spouse or child member, you're going to be eligible for $1,500. January the 3rd, that will be put into that new account. Okay? But you have to go on to Lively once you get your email and you say welcome and get all that situated so we can put that money. So we have somewhere to put that money. Okay? So you can get that money. But we're going to be here to help you. Lively's going to be here to help you. It should be a walk in the park. And the reason that I say about the P.O. box and the street address is, again, we don't want to hold up you getting your card. If you put that P.O. box in the street address, you're not going to get your card. They're not going to issue you that account. Okay? But you probably already know that because you all have an account right now, so that's probably not a problem. But just in case you recently changed your P.O. box, then you okay. Any questions with that? Yes, sir.
What happens when you retire and you have an HSA account at Lively? Stay there? Or
Stay there.
If you want to keep it there, you can.
I know a lot of people that put money in it to help pay for their Medicare supplement plan.
Yeah, well, I'm just saying, do you keep it with Lively or do you have to move it out to
No,
something?
you can keep it or move it, whatever you want to do. The HSA accounts are individual bank accounts. They're just like if you walked up the street to Chase Bank and walked in there and said, I want to open a checking account. It's your account. The money that goes in there, whether it's put in there by the city or you, it's yours. It stays yours forever, whether you use it or not.
So with that being said, you don't have to move your money from Insperity PayFlex to the new account. You still will be able to use that. However, the city won't be sponsoring you anymore. So now Insperity PayFlex, whatever they're calling themselves, is going to charge you an admin fee every month to keep your money there. Like your banking checking account, a lot of banks will charge you a fee if you don't have enough money in there and stuff like that. So you have that option. You can leave it there and use it however you want, or you can move it. So it's up. Yes, sir.
Yeah, is HSA account only for the high deductible?
Yes.
HSA account only for the high deductible. The loan is Also, just a reminder, I don't think anybody's this old in here, but if you're 55 or older, you are allowed to add an extra $1,000 above the normal HSA contributions each year. So don't forget about that.
And remember, it helps with your taxes, lowers your taxable income.
Yep. And it stays tax-free forever as long as you use it for medical, dental, or vision expenses. It grows tax-free, so if you are investing in the investment options, which are basically like mutual funds and stuff, you can also access Charles Schwab investments through Lively's online system. It grows tax-free, stays tax-free. You put it in there tax-free, so triple tax-free. The cleanest, best investment you can possibly do. Because you will have medical expenses at some point in your life, the older you get.
Any questions on that? Concerns?
Okay, so this is basically kind of the buy-up traditional plan that is not an HSA. It is in-network benefits only. Again, it's the exact same buy-up. We call it the EPO in the current benefit guide. $2,000 deductible, $6,000 out-of-pocket maximum, $25 office visit for primary care, $50 for specialists, and the drugs are $10 for preferred generics, and $35 for preferred brand names, and $70 for non-preferred brand names.
This plan is the most expensive out of your pocketbook. Okay, you might say, oh, it's cheaper for my prescription. Oh, it's cheaper for my primary care visit. And that's great because that is showing. However, it's most out of your paycheck. Okay? It's a higher out-of-pocket cost. So you really want to look at those things when you're making a decision on what plan's the best that suits your family. Okay? Because it is the most costly out of your paycheck.
And then believe it or not, if you have something big go wrong, you will end up paying much more out of your pocket being on this plan than you will on the high deductible plan.
Yes, sir.
How is that when the local plus is 30% when you go to the hospital and the buyout plan is 20%?
Well, what's the out-of-pocket maximum on the local plus plan?
They're both 6,000.
No.
Right. So those two plans are from an out-of-pocket standpoint are essentially the same. What I was comparing it to is the high deductible plan. So the high deductible plan is a $3,500 out-of-pocket maximum. So it's counterintuitive because if you're on the high deductible plan, you're going to get there faster because you're paying the first basically $3,500, but your out-of-pocket overall is less by almost $2,500 than it would be on either of the other two plans.
So if you took that premium that you're paying out of your paycheck every month, that higher premium, and you put it in your HSA, you're going to come out ahead in your high deductible plan if you have a catastrophic situation. If you have something happen during that year, or you're just throwing your money away on premiums. If you don't have anything going on during that year, right? The premiums are the premiums and you're just putting that out. If you were putting in that HSA account, you're going to save on tax money. It's going to be your money. You leave or what have you, it's your money.
And the city gives you money.
And the city gives you money. And it's a lower catastrophic situation. If you're looking at $3,500 out of pocket, then we cover 100%.
So really, if you consider the money that the city's going to give you, instead of a $3,300 deductible, you really have a $2,300 deductible on high income. And once you hit that, you're pretty much done paying almost for the rest of the year.
So if you know you're having that knee surgery or that elbow or shoulder surgery or something, you might want to look at the high deductible plan.
The only time that the other two plans really kind of make sense is if you're taking maybe one, maybe two drugs that are fairly expensive drugs. Then you really have to look at which tier copay does that fall under, and how much does that cost me if I work that out over 12 months, and then figure out the difference between the cost of the premiums for you for those two plans versus the high deductible plan. Like Melanie said, if you're putting the difference in those premiums away in your HSA every month, you're probably going to come out ahead on the high deductible. Any questions on that?
So, not a question, but on the high deductible plan, you know, you can use it in the future for reimburse medical expenses, but you can reimburse medical expenses for any time that you've been covered for a high deductible plan. So I've been in it for 8 years, and I just save all my receipts whenever we have medical expenses. I don't touch that money. And then when I retire, I want to pull money out, I can reimburse those medical expenses at that point. And since I've been in there for 8 years, I think I've put about $8,000 a year on average in there. And my high deductible plan has $120,000 in it. So that you know, if you're talking about what costs money and what's expensive, you're giving up investment earnings if you're not doing high deductible plan also. And it's tax-free investment earnings. It's the only tax-free retirement savings there is. It's completely tax-free. It's a fantastic deal if you're looking at it from that perspective.
If you do that, and not everybody can swing that, but if you do that, it's like having a whole other retirement investment.
And that's why we have 3 plans, because not everyone fits everyone, right? Because you do have to have that deductible up front if something major happens. Your bank account, you might not can do that.
Yeah.
You know, it depends on your finances, your budget and things. So that's why we offer more than one plan so that you can choose what's right for you and your family.
If you're on the high deductible health plan and you have a big balance built up in your HSA account, your checking side, you need to look at the investment options that are available to you to do that. What I typically do, when I'm on a high deductible plan, I get enough in there to cover at least one deductible for my family. Right? And then anything above that, every single year I go back in and I look, and anything that's above that I've built up in interest or whatever, or investments over the year, I sweep it back out, put it back into the investment side, and just leave it alone. And that thing just grows and grows and grows and grows and grows. And if you're one of those people that doesn't ever go to the doctor, you definitely should be on a high deductible health plan. You should be pumping as much money as you can stand to pump into the HSA. So again, I mentioned that on the Local Plus, the base Local Plus plan, that basically mirrors what we currently have under the Kelsey Care plan, but you're going to expand the network. So you still have Kelsey Care in there, Kelsey Seabold, but it's going to add Southwest Women's Health Alliance, Renaissance Physician Organization, St. Luke's, Texas Children's. Instead of just right now, you're only able to go to Kelsey Seabold under that plan. So that's the cheapest plan.
What about Methodist?
I don't. Is Methodist on the?
I think it is. Memorial Hermann is.
Yeah.
On the website it shows it, but on your slide.
Yeah.
On the website?
Yeah. So.
Websites.
Yeah, I think the only one that's not in the Local Plus network is maybe Enrollment. I'm not 100% sure. Yes.
So if you can go back, so the last medical plan
Wrong one.
is the one that we had at Kelsey Care this year, right?
Right.
Yes.
Okay.
So if you're looking on page 11, it's the one that says base Local Plus plan.
That was Kelsey. That's Kelsey.
That is what was Kelsey Care this year.
Yeah, let me ask a question because I have this plan that I've been through so many times in Kelsey this year. So, quick question is this plan. So, when you had a Kelsey Care plan that you're stuck with to go to the everything from the Kelsey. Everything
Yes.
was being managed by Kelsey, no matter what.
Right.
The primary care, specialists, all that. So in this plan, if you go next year, it will be still like dependent on the Kelsey Care.
It's not dependent on it, you can go there,
You can go there
but
if
you
you
can
like
also go
Kelsey.
other places.
You can still go to Kelsey, but
And
you
this
can
one-
also go to all the other ones that are in that network.
Because my experience with being in a Kelsey Care plan that you cannot go.
Yeah,
That's
so
a full stop.
that was the way the Kelsey Care plan was
And,
designed.
and that's a funny thing happened because I went through with the insurance. So when you go to the Aetna, even though you have a Kelsey Care by Aetna, Aetna say you can go. Well, Kelsey said you cannot. So I had this experience because I have a newborn, so I know better.
So the only, under the current plan, the Kelsey Care plan, the only time they would send you outside of Kelsey Siebel was if they needed a specialist that wasn't that Kelsey Siebel didn't have. Yes.
So I tried looking up Viat going on Cigna,
Uh-huh.
there's nothing there, so what do I look for? Because I'm trying to make sure all of my current.
It's a local, the Choice Plus network. Which one is it?
Local Plus Network for that one.
Oh, I'm sorry, yeah, Open Access Plus, OAP. OAP, Open Access Plus network.
That's on the other two.
And same thing for the high deductible plan. If your doctor's on Aetna, I can almost guarantee you it's gonna be on that Open Access Plus Cigna network.
Because when we do this, just to let you know, when we have the request for proposals and we're checking with everything to see what's the best for our employees and things, we're looking at utilization too. We don't get your health records or anything, but we can tell what doctor she
Yeah.
is or what have you. So the insurance can, they don't tell us.
We basically went to Aetna and
And
said,
there's like,
tell
it's
us
like
every doctor that every
99 point
employee at Bel
something,
Air
so.
has gone to in the last 12 months. And then we fed that over to Cigna and they ran it through their system and said, these are the doctors that are in there, these are the doctors that aren't. And it was like 3 or 4 doctors difference. And some people picked up doctors that didn't have doctors with Aetna. So you're never going to satisfy everybody 100%, but it's about as close to getting there as you can get. Yes, ma'am.
So I have a question on, back on the HSA. The city's increasing it to 1,000.
Yes. It was 650 before. And it was tied to the wellness program, and this, going forward, it's not gonna be tied to the wellness. They're just, whether you do your wellness or not, going forward, they're just gonna give you the
So
HSA.
does the wellness incentive increase as well? Or that's-
So the wellness actually discounts your rates,
Your rates.
okay? So if you complete the wellness program, it discounts your rates. So it makes the high deductible plan cost zero for an employee. It makes the local plus base plan cost zero. If you didn't do your wellness, it's gonna cost you like $10 if you're an employee.
Oh, okay. So now it's a $0.
And for individual, what's the max they can put into?
3,300 this year? Or-
They just changed
Well,
it.
it's 4,300, but the city's gonna give you 1,000.
So you can
So
only
your
put
portion
30.
of it, you can put $3,300 in over the 24 pay periods. Yes, ma'am.
So with the, going back to the health wellness care thing that they have to do, is there any place on here where it's going to say, like, because my husband's on my insurance, and if he doesn't do it, how much is going to be?
Yeah, the rates are right in front of the medical plan section on page 8 and 9.
So her question though is if she does the well here,
Yeah.
doesn't, how does that?
So if you look on here, it says both do wellness or only one does wellness.
So your little, end note, so if you're on number 2, if you're on page 8 and you look under medical, it says employee plus spouse and there's a little 2 up above there. That's if you both complete the wellness. So down at the bottom, there's employee plus spouse and a 3, employee only completes wellness. So that's the differences in the premium.
Make me pay for it. Just saying.
Okay?
I just finished my wellness.
Exactly.
So
And again, those wellness, once a year, even no matter what plan you're on, you go there, don't let them diagnose anything. Tell them I'm here for my annual wellness. Don't tell me I'm,
yeah.
I just want to be here for you to get my wellness. It'll be
cost you?
Once they start diagnosing that stuff, then they want to charge you.
That's, yeah, so that's
So you
30,
know what plan you're on.
dirty little secret, if you go in for your wellness exam with your doctor, which whatever plan you're on, it shouldn't cost you a dime, even if you're on the high deductible plan. You go in for your annual wellness exam with your primary care physician, that shouldn't cost you anything, even if you're on the high deductible. Okay? If while you're in there, you go, hey doc, you know, I've got this rash over here on my elbow, can you take a look at that? Boom, that's a new office visit right there. So then they charge you for that one. Okay, so your annual wellness exam, you go in and just say, all I want is a wellness exam. And go in and get that done, leave, they're not gonna charge you anything for it.
They always have a habit of asking you. Yeah.
And make sure that you tell them whatever blood.
Yeah, I will charge the copay like this.
No, let me tell you what, this has happened to me. So basically they charge and say it's against the blood work you did. But blood work is supposed to be a part of that whole
Right.
illness control.
So you have to
Well,
show that.
so it depends what they're running on your blood work.
Yeah,
So if they know you already have a condition,
they might run.
Oh.
they might run an extra couple tests or whatever to check or something.
That's right.
Yes,
Yeah. I'm gonna direct this to Melanie. Fire department does, we do ours in-house, our wellness, our health assessment. How does that affect this?
It's,
Because we're not going to a physician, we have a nurse practitioner on site that signs off for it, but we do ours every year.
yeah, but
As
she's,
long as they
she's
fill
filling
out
that
that
form out,
form.
for you. So that's fine.
and it's
Yeah.
got all the information that that form asks for, that counts as your wellness.
Because annually you have to be by law to do that, so I'm just like,
Yeah, we just do it in-house, so it makes it easy.
What time are we supposed to
I don't know that you'll pass it.
oh, that's tough, that's tough.
It's the physical aspect of it.
So prescriptions, I'm sorry, Mr. Mayor.
Yeah, so your prescriptions, hopefully this is gonna be a little easier on everybody than that has been. That's kind of one of the things that is sort of unfortunately known for, is being a little strict on the pre-certification for certain prescriptions and things like that. So make sure, hopefully, maybe some of you still have it on your phone, download the Cigna app. And that's another thing, I brought this up. Cigna is not sending out ID cards anymore.
No one is.
Yeah, pretty much
You're
nobody.
not getting anything in the mail but your HSA card.
So you can, once we get you in the Cigna system, you will be able to go into Cigna online and request them to send you, if you really want it, they will send you a physical ID card. You have to log into your Cigna account online and request an ID card. They are not going to just send everybody an ID card. Now, if you download the My Cigna app, your ID card is in the app.
Not yet, but it'll get there.
Once you have your ID number to log in, once you open it, one of the things that'll be on there is ID card. You can click on it and pull your Cigna ID card up. So nobody ever goes anywhere without their phone. You might leave your purse or your wallet at home, but you're not leaving your phone. And so you'll always, if you have that My Cigna app, you'll always have your ID card with you. The other thing that the app is really good for is searching out urgent care facilities that are in network. And we've discussed this. I try to make this speech every year. 90% of all these urgent care facilities you see all over the city are not in anybody's network. Okay? And they charge like they think they're an emergency room. If you go to one of those non-network urgent care facilities and it's not a true emergency, you are going to end up with a huge bill. Okay? They will tell you, we'll take whatever your insurance company is going to give us, which is correct. They will.
There it is. True statement.
But what they don't tell you is I just went out of network. So if you go look at your benefits on page 11 for your plans, the EPO plan, the Local Plus plan, doesn't have out-of-network business benefits, does it? The EPO, the buy-up, doesn't have out-of-network benefits, does it? Guess who's paying the bill? If it's not an emergency, you are. And if you're on a high deductible plan, which does have out-of-network benefits, you just doubled your deductible because you're out of network. So guess who's going to get that bill? You are. For anything that the insurance company, I mean, they're going to cover it, but you've got a double deductible from what you would have been if you were in network. So the thing I'm trying to emphasize is when you have that Cigna app on your phone and you need an urgent care facility, you can pull it up, and that's specifically one of the things that's on there is urgent care facility. And don't click on it and you tell it use your location. It will tell you where the closest one is to you. It's actually in the network.
Yes, sir.
So my wife had her gallbladder removed this year, and the anesthesiologist was not in network.
Yeah.
How does that?
So
that's nothing that we can do.
yeah, no, you can't. So anesthesiology, radiology, pathology, and labs in a hospital, they don't participate in anybody's network. Okay, so if you get a bill from an out-of-network provider like that, usually what happens is the carrier and them work that out. So if you get a bill like that, you need to let Melanie know, and we'll work it out with the carrier, help you get that done. You can also, a light, which used to be Compass, if you get a bill from a provider and you're like, why are they billing you so much more? Or if you think anything's wrong with that bill, especially if you go in the hospital. Hospital bills are ridiculous. You know, you get 30 pages of CPT codes and dollar amounts, and you're like, I don't even know what any of this stuff is. You can literally take that hospital bill. I did this. My wife had pancreatitis a few years ago. Spent like 3 weeks in the hospital, and we get this stack of bills like 50 pages thick. And I basically, every single one, every time I would get it, I would just scan it over to a light and say, tell me what that's. And they'll go through it with a fine-tooth comb. And if there's something wrong, they will contact the hospital for you and negotiate it to be rebilled the right way. And hospitals do it all the time.
And I think this is a program that all of us aren't quite aware of. Maybe once a year at open enrollment, we get told about it, but we don't really need it. We don't think about it. We don't have it. This is a service that's free to you. Okay? It's all a light. I want to call it all right, but all light. Okay? What they can do is if you get a bill from a dentist, you get a bill from a medical provider, you get a bill from whatever, and they're charging you more money, and you're like, I don't think that's right. I'm not really perfect about this, or whatever. Send it to them. Reach out to them. Call them. Text them. Email them. I don't know if you text. Email them because they will review it. Okay. I'm in a position I pretty much know what our benefits are and how they should get paid and things. Well, my dentist decided to send me something, and I said, well, no. Okay, well, I'm not going to argue with you, but all right. So I've never used All Right. This is the first time that All Right. Before. So I said, you know what? I'm going to utilize it and see what it does for our employees. We offer it. Let me make sure I know how it does. Send it in. Sure enough, they reviewed it, came back. My dentist gave me $100 and something back. Okay. I'm not saying that's going to be all the time because we do get bills that that's our responsibility. Okay. But if you have any questions whatsoever, give them a ring. Also, what they can do is help you find a provider. Maybe your doctor said you need a CAT scan. Maybe your doctor said you need an MRI. And they said go over here to the hospital because you're already here.
Don't do that.
Don't do it. The hospital has to pay overhead. They're going to charge you whatever. Call Cigna, call Alight, whatever their name is, and ask them. They're going to find you a place to help you with your benefits, to help you less money out of your pocket. Because you might have go over here to a freestanding x-ray facility, CAT scan facility, okay? I've done it myself. Over here at the hospital, it's gonna be $1,700. I don't even pay $1,000 over here at the freestanding place, okay? This was before. So please use it. If you've never seen a doctor, you don't really know who to go to or anything, give them a call.
They will literally make the appointments for you. If you tell them, I want to do an appointment on a Friday between this time and this time, they will literally call the doctor and make the appointment for you. They usually will make several appointments, and then they'll call you back and say, okay, we got one on this day at this doctor at this time, or this day at this time, or this time, and then tell us which one you want, and then they'll call the doctor's office back and cancel the other two. Yes.
So do I have to get a separate, order for that, or how would I, do I send them the order? Hey, this is what they told me, go to this.
Well, so usually, typically, and I just happen to know this because my son collects and broke his bones all the time. You know, the doctor at Fawn and Orthopedic would say, hand me an order and say, go downstairs and get your MRI done or your X-ray done. And of course, Fawn and Orthopedic owns that MRI clinic. And so I would say, no. Let me check with the light. And I'd get on the phone with the light and they go, okay, you can go up the street and literally, because they're going to charge, because the light knows how much they're going to charge you. And I think at Fawn and Orthopedic, you get an MRI, and their MRI clinic downstairs was like $1,800. And they're like, you can go 2 blocks up the street to this freestanding imaging center, and it's going to be $400. And I'm on a high deductible plan like a lot of y'all are too. So if you're talking about that much money, that's your money, because you have to pay that deductible on the front end. Yes?
For that example, Harris, was it real time? Like you called while you were there?
Yeah.
You didn't have to fill out a form to answer the question?
You can answer your question on the phone.
Now, if it's something like you want them to review a hospital bill or something like that, that's a little different because of the HIPAA laws.
Yeah, okay.
So it is and I will give you this, it is a little bit of a pain in the rear on the front end of things with the light, when you're talking about them having to be able to deal with a provider on your behalf, like a hospital or an emergency room or something like that, because they have to get you to sign off on all the HIPAA forms that allow them to access your private health information with that provider. So yes, on like a bill dispute or something like that, it's a little bit of a pain in the rear, but trust me, it is well worth it, especially if you're talking about a hospital bill or an emergency room, for them to go through it and negotiate it.
We all know about the wellness plan, rewards, all that good stuff. Do y'all want to hear about it again?
So just one thing to reiterate, the wellness plan is completely separated now from the HSA. So you're going to get your HSA account money regardless of whether you did wellness plan or not. What it does do, if you do complete the wellness plan, you will get a reduction in your premiums. Yes.
So, for example, if I take HSA is coming in, and let's say I put the maximum of 3,000 plus 1,000. Next year, the EPO, the buy-up plan.
Yep.
So since I'm in that plan, am I going to be paying a monthly fee or anything like that reliably, or?
No. So the city pays the fees, the monthly fees for the life insurance.
As long as we sponsor it,
Yeah.
you won't be paying a fee. The only reason you would pay a fee at the other is because we're pulling out.
No. What I'm saying is like, even though I'm not like, in 25 I'm doing HSA, and in 26 if I do the EPO or the buy-up plan, I'm not in the HSA plan anymore. So do I pay a fee? No.
The city's paying all the HSA account fees.
And if you retire, same thing, as long as the city's still
Yep.
lively.
Yeah. Unless we switched it.
in the future for switch.
Yeah. Hopefully, we're never gonna do that thing.
Can't say never.
Can't
Don't
say
say
never.
never.
And that's kind of the point of going to life.
It really is. It really is. Because it's just stressful for employees. It's a lot of administrative work and you just don't want to do it. Okay, so we did all that.
And I can do HSA medical and then EPO dental.
Correct. So, as I said earlier, the dental plans, couple of things that are changing for the better is if you're in the dental PPO plan, we are adding children's orthodontia onto the dental PPO plan, which we've never had before. It was only on the dental HMO that you had orthodontia, so orthodontia, for those of you who don't know, prices basically for children under the age of 19, okay? So that is a covered benefit now on the dental PPO plan, which it wasn't before. Also, the calendar year maximum right now, I think is $1,000
Right.
in benefit a year on the PPO plan. We doubled that, so that's going up to $2,000. So awesome for everybody. Other than that, the plans aren't really changing that much, except for the moving over to Lincoln Financial.
And on the Cigna app, now that you said you can click on the urgent care and then know what you're so I'm on the HSA plan, like for example, I'm on the EPO plan right now,
Yep.
and I know when I go to my urgent care, I pay about $7,000. I always know that. Plus if they do something else, but most of those cases it's $7,000. But if the HSA, the Cigna say, hey, if you go to urgent care A, it's going to be this much for a visit.
No.
It doesn't say that.
No, but they do have contracted rates,
Yeah.
so they can only charge.
You should be able to
No.
see, if you go online,
Okay.
the thing with urgent care is, you know, they don't really
Right.
know what exactly the diagnosis is, and that can change things
Okay.
drastically. The most important thing with urgent care facilities is try, if all humanly possible, to make sure it's in that urgent care facility.
And be careful with that too, sorry, James. Be careful with that too, because if the urgent care has emergent in their little title anywhere, they consider themselves an emergency room,
Yeah.
okay?
Some of them
It's not urgent care.
actually look on the door as you're walking in. Some of them actually specifically say on their hours, urgent care facility from like 8 in the morning until 8 at night, and then after 8 at night, it becomes an emergency room. So it's a wrap.
How do I find out if my dentist is in network? That way I can make sure I choose. If
So
he's in
go to-
network, I'm gonna wanna choose.
So we've got the link on Benefits in Hand to Lincoln's website. So specifically, I think the link is for the DHMO network, but I think you can get them both in that same website. But for those of you, and that reminds me, for those of you that do sign up for the DHMO plan, you will need to make sure as you're doing your enrollment to fill out the provider number, look up the provider number for the provider that you want to choose as your dental HMO doctor, and put it on your enrollment as you're doing the enrollment. And the link for that is on the Benefits in Hand website. It should be on the right-hand side.
Different people in your family can have different,
Yes.
yeah.
Yeah. You can have your kids go to a pediatric dentist specialist if you want, or a normal general dentist, however you want to do it. So the vision benefits, again, there's not a whole lot changing on this, other than removing it to Lincoln Financial. It used to be kind of built-in part of the medical plan. That is a throwback, going way back to 2012. We have broken it out on its own now, so you don't have to enroll in vision, where before we kind of enrolled everybody in vision, no matter what. We increased, so currently our plan gives you lenses, glasses, lenses, and contacts once every 12 months, but frames were only every 24 months. So that's been changed to doing frames, lenses, and contacts every 12 months, so a little bit better.
One or the other.
huh?
One or the other.
Yeah, one or the other. You can't get both in the same year. You either have to get contacts or glasses. Also, on a lot of the maximum allowables for the vision plan, those are going up a lot on a lot of services. So it's a little bit better plans.
Is Costco optical covered under this?
Who?
Costco?
No,
I'm not
Costco's
sure, I
in your
have
network?
to check.
Yes.
Oh,
But-
Costco's in that?
Lincoln Financial is our dental and our vision, okay? So when you go to the dental, you tell them Lincoln. If you go to eye doctor, they might not, Lincoln, it's Lincoln, that's not Spectra, that's not whatever. Well, if they ask questions in your book on page 20, it tells you that we're in the Spectra network. Eye doctors, vision doctors, this name's been around a long time. They're gonna know what that network is.
Also, forgot,
Also,
on the dental plan,
Spectra.
like the medical plan, nobody's doing ID cards anymore, so you're not going to get an ID card, physical ID card. But if you tell your dentist, I'm in Lincoln Nash or Lincoln Financial, then it should go to the center. If not, there's contact information in here. Lincoln has an app also.
And they will send you a card as well. if you-
No, if you ask for it. Now, some of them won't send it if you ask for it.
They
Signal will
don't
do
do
it if
any
you
ID
ask
cards
for
at
it.
all, right? Yeah.
Now,
But if you have an app, if you have an app, you'll be able to pull it up, won't they?
Yeah, you don't even have to download the app. If you go directly to lincolnfinancial.com, you can download your dental card from there. And then there's another site on this booklet here for vision. You can download your vision card from this site as well.
yeah, and all those information's in this book, in your handy dandy book right here.
What page is that?
One of them.
One.
The vision card, by the way, will say Spectera on it.
One of them.
You tell any provider Spectera, they'll be able to know which Spectera.
Now, even though we broke it out, because you never saw vision as a charge, okay? City still pays the employees. City pays the employees for dental. City pays the employee for a medical plan. Okay, so there are options for you.
For the DMO, dental vision.
Right.
So basically, if you choose the dental PPO plan, you're just paying the difference in cost between the employee-only cost of the dental HMO and the dental PPO.
Life insurance.
Life insurance, okay. The city provides every single employee 2 times your base annual salary of basic life insurance and AD&D insurance. So whatever your salary is, multiply it times 2, and the city gives you that much in life insurance. Unless you make more than $100,000 a year, because the cap on this is $200,000. So if you make more than $100,000 a year, you're capped out at $200,000 that the city pays for. This is also all life insurance and disability insurance is moving over to Lincoln Financial. So the other thing is voluntary life. So if you want to buy additional life insurance, you have the ability to do so, but you're going to pay for the voluntary life insurance. The rates on that are basically exactly the same as they are right now. So if you have voluntary life insurance, you enroll in the same amount, you're not going to see a difference in coverage or in your payroll. However, Lincoln allowed us to do the guarantee issue on the voluntary life insurance up to $200,000. Right now, I think our guaranteed issue is $100,000. So we basically have doubled the amount of voluntary life insurance you're allowed to purchase under a guaranteed issue. So that means you don't have to get a physical or be approved for it. You can select up to the full $200,000 and not have to provide any evidence of insurability.
That's for you, huh?
Nope, that's for everybody right now.
Because we're changing carriers this year, they're giving us what we call a true open enrollment. So regardless of what you have right now, you can get the full $200,000 of additional coverage
No questions
Without
asked.
any, no questions asked.
So that, is that this year only?
That's
Yes.
this year, so this open enrollment only. Going forward, you'll be able to, as we do it in $10,000 increments, you'll be able to bump up to $20,000 a year going forward, up to the GI.
So say this year you sign up for $200,000 extra, not what the city pays, but extra. No questions asked. Next year you come and say, okay, well, I don't want them to ask me any questions this year either, and how much can I do? Is that 10 extra or 20 extra, George?
20.
20. So
No, it's 20, because it's 2 times.
two 10K increments.
2 increments.
And you can actually keep going to the plan max, which is 300. So even if you max out for GI this year, next year you can do another 20K.
If this year, if you pass on it, next year,
You will have
You
to.
match
add-
Only add 2 times, or 20,000 above what you have.
so it's something you gotta think long and hard about this year before you
Yes.
pass on it, because you won't be able to jump back in at 200,000 next year.
Right.
Correct.
What does it cost? Do we know the cost?
It's on benefit in hand if you go in there because it's by your age and how much you make and all that stuff, so those rates go up.
The rates, you don't have the rates for life insurance here, do you?
No, because it goes by your age and everything.
24?
Now you have to figure
Oh,
out
yeah.
the math.
Yeah, so the rates for the voluntary life insurance are on page 24, kind of towards the center of the page. And that rate that's on there is per 1,000. So if you were getting 200,000, you basically have to multiply that rate that's appropriate for your age times 200. That would tell you how much it would cost you to get $200,000 of coverage.
If you're in your benefit in hand site
Yeah.
and you go in there, it's automatically going to tell you,
Yeah.
you don't have to do the math or anything.
Yeah.
You can play with it. I know I don't want that much. Oh, okay.
So when it says employee and spouse, does that mean?
So if you're covering your spouse, it's the same rate.
So it'll be 2 times this, or it's not just included?
Yeah. And the spouse GI is actually different. So for spouses, it's only 50K. That's the max guaranteed issue for a spouse.
And do they investigate suspicious deaths?
Only on you, Jim. Only on you.
You're the one that's going to be killed.
Exactly.
I want somebody to investigate when I'm dead.
You're right. He's worthless.
I work way more dead than I am alive.
Whatever the month by like 200,000.
Okay, the disability insurance, really nothing's changing on that. The long-term disability, just to reiterate for you, if you're out more than 180 days on disability, then the plan kicks in, the long-term disability plan kicks in, that the city pays for, and pays you 60% of your pre-disability earnings up to a maximum of $5,000 per month. So it is capped out at that much. And then your actual payment would be, and actually when you're going through benefits in hand, because the salary information is in there, it will tell you what, as you're in the long-term disability section, it will tell you how much your monthly benefit would be. So if you're curious. Okay, flexible spending account. So for those of you that don't enroll in the high deductible health plan, so either the base plan or the buy-up EPO or Local Plus, you also have a pre-tax, it's not really a savings vehicle, it kind of is, but to be able to put money away out of your paycheck on a pre-tax basis for same thing, medical, dental, or vision expenses. Okay, just like you would be if you were on the HSA. The difference is on this. So for 2025, the healthcare limit, FSA limit is $3,300, and the money in those accounts that you put in those accounts is, for the most part, what we call use it or lose it. So if I put $3,300 out of my paycheck over the next 12 months, in 2025 into my flexible spending account. If I don't use it all by the end of the year, I am allowed to roll over. We don't know yet for sure because the IRS is the IRS. So we think it's going to be $660. You would be able to roll over $660, but if I maxed it out and didn't spend any of it, I would lose all the rest of that to the plan. The plan is to keep it. Now, the trade-off for that is, if I say I'm going to do $3,300 over the year, I'm allowed to claim against that whole $3,300 on January 1st, if I need to. Whereas on the HSA plan, it's like a checking account. If I don't have the money in the account, I can't use it. I can pay myself back later when I do have the money in my account with pre-tax money. But I can't actually spend it out of my HSA account until it's actually. Does that make sense?
So there's dependent care too. Dependent care is only for daycare.
Yeah.
It has nothing to do with,
So there's also dependent care FSA, which that's a completely separate thing from the healthcare FSA. You can put up to $5,000 annually into a dependent care FSA account. So if you've got young kids that are in daycare and both you and your spouse work, you can put money pre-tax away to pay for that daycare. It's a really cool benefit. I mean, because it's expensive daycare these days.
How do you pay for this?
So basically, you get a bill for it, and then you file a claim through, and they reimburse you. Yep.
You talk about the flexible spending. You say you can claim it in the first beginning of the calendar year.
Yeah.
So what if I quit my job in March?
you don't get, if you have any money left in that account, you don't get that money.
No, but you can use the money.
You can
and
use
then
the
wait
money.
Before you put the money in, you came out ahead.
So,
Because
so,
if I have 3,000 in state, they're going to spread it over 24 acres.
Right.
correct.
But if I spend the 3,000 in January,
Yep.
but I put it in March, you haven't deducted it.
Yeah. The plan loses the day.
It's a liability on the city. However, it kind of washes out because if the employee leaves and they haven't spent the money stays in our pocket.
And it's always been like that.
Employee
Like,
leaves.
it's
Oh,
always
yeah, yeah, for ever since.
That's what I was saying. It's kind of a flip of the coin, you know? The city loses out on some money and the employees gain on some money.
And you can't there's no way legally we could have employees agree to.
Yeah.
We don't want to do that.
And you could.
Yeah.
Now, I didn't know if you could.
Yeah.
Can I ask you this? So if you have money in the FSA account, let's say in the beginning of the year, I put 4,000 in, and the person leaves in March, and they still have access.
No.
You only have access to an FSA account while you're employed.
So you can't put
Because
it
we're,
in, right?
No.
no.
It's going to be even.
You have access to the full amount you committed to for the 12 months immediately, even though you haven't contributed that much in there
Oh, I
yet.
see what you're saying.
As an employee, you can't say, I want to put it all in now.
I got that.
So
So it's
like
just
the
whatever.
city puts it in, it's a liability on the city. If we're saying you're gonna be here all year.
Yeah.
So you said you wanted 3,000, the city on that first January 3rd, we're gonna put that $3,000 in there, but we're only gonna take it, so we're gonna divide that
Over the
3,000 by
24
24 pay periods. So we're only gonna take it each time. But say you go on January the 5th and you use that whole $3,000 and then you left at the end of January or February, we get that.
Okay, but if the person is worked up until March, whatever money they put in through March, can they use that?
No, not really. They have to-
Actually, if the claim was incurred before you left, yes, you can file for reimbursement.
So, but have, oh, sorry.
Those ladies right there,
Okay.
they will tell you everything you want to know about it.
On the HSA account,
Yes, sir.
if you went to the portal or someone to check the balance.
So that's the reason we've always typically kept it with the medical carrier was because that functionality is there to where when you log into your medical plan carrier, you were able to see the HSA account balance, you have to go to a separate website, the Lively website, to see your account balance. Or app, yeah.
So let's return.
Employee Assistance Program, UTEAP is here. I always tell people the Employee Assistance Program is basically like 311 for life problems. So legal problems, mental health issues, substance abuse issues, things like that. They can help you get directed to the appropriate help for you.
I just have one other question. What if you have money, like you could see go local, right? What if you have money left?
Let's hold that question, and we'll come back.
So again, the LCC World Diabetes Program, this is something the city pays for completely outside of our medical plan. If you have diabetes or pre-diabetic and want to try to get it under control before it becomes diabetes, talk to these ladies over here and get signed up. The city basically pays for that whole program. You don't pay anything for it.
You don't pay for your medication.
Including your medications. Okay? So it is well worth it if you're a diabetic to talk to these ladies over here and find out what the plan offers.
Regardless of what medical plan you're on?
Regardless of which medical plan you're on. Yep. So Colonial, again, I think I mentioned this earlier, basically Aflac is, as a city-sponsored benefit, is going away on January 1st, okay? So Colonials aren't replaceable with that, and a Colonial rep is over here. If you're interested in talking to her about what plans are being offered, you'll also be able to see all the different plans. You're going to actually be able to enroll in these Colonial plans using the benefits enhanced system online as you're doing your open enrollment. And all the plan details are linked on the benefits enhanced website, but she could probably give you some more detail as to what the different plans are. Essentially, we replaced everything we were offering with Aflac with Colonial plans. Okay, and they're hopefully going to be cheaper for most people.
And I just wanted to, and that's the end of the presentation, but if we could just go back to UTEAP real quick and give a little more information about that. That's a free service to you and your family members, anyone in your household. We do not find out who went, we do not find out why you went, okay? And they want you, when you call them, there are counselors or whoever 24/7. However, when you first call them, they're going to ask you some questions. You're going to feel like maybe it's a little call center kind of thing because they want to make sure you're okay. They're going to ask you some questions. They want you to be invested on who you select for your providers. So they're going to provide you a list of providers in your area, wherever they told you. The only reason I tell you that, they want you to be invested. They want you to do your research and feel comfortable on who you're going to see and talk to. But at no time do I want you to feel like you need to wait for that. If you are feeling that day or that time or that family member needs somebody right then, I want you to call me. I got the bat line. Okay? We got the bat line. We can get somebody on the phone for you that same day. And they're very good about that. Yes, sir.
Does the city still offer that legal plan where they do the will, the living will, and all of that?
No, we don't have that.
That slide said UCAP would do a will.
They will do it.
Correct. So we have an online library of on-demand resources. We have a legal library in there where you can go and download a template, for example, a living will, and you can just download the template, fill it out yourself, and then you take it to a bank and get it notarized. It's that simple. So we have an online library of legal templates, and it's for free. The city is taking care of the cost for you.
And Lincoln has on their website also, you have thing for online like legal will services.
Yeah, and I think some of our value adds are in this booklet here. One of them is being it's called life keys. So one of the benefits of life keys is a will prep service, which is kind of legal, financial advice. Some of the same resources over
we have a couple of options for you.
Tracy wanted me to remind you that she's here.
I did not.
She'll know right, everyone's in the same.
Yes, thank you.
Also, for those, if you know somebody that needs help enrolling in their benefits, Deborah, who's our account manager, and I will be here from 8 a.m. tomorrow morning until 5 p.m. tomorrow evening upstairs in the conference room. So if you need